President Trump is set to make what's being called a big announcement regarding Prime Minister Netanyahu's ongoing plans for unilateral annexation of parts of the West Bank. Facing at least 473 new coronavirus cases in the last day, Israeli health experts are warning the country is on the verge of losing control. And Russians begin a week-long public referendum vote with sweeping constitutional changes on the ballot, including a long-term extension to Vladimir Putin's presidency. Hello, I'm Sarah Coates. Thanks for joining me. Well, the number of coronavirus cases continues to climb here in Israel, with at least 473 fresh infections in just the last 24 hours, with health experts warning authorities that the country is on the verge of losing control. Now, the daily total marks the highest number of new infections in 2 months, with the military opening new hotels to quarantine patients. Now, as part of the effort to contain and trace the infections, testing for the virus has been at an all-time high, with nearly 17,000 carried out yesterday and nearly 20,000 the day before. Now, in response to the outbreak, police have stepped up enforcement of health guidelines and are focusing on implementing specific restriction zones. Now, there's controversial legislation allowing the Shin Bet security service to track civilians' phones in order to stop the spread of the virus cleared the first vote in Parliament Wednesday. Now, the vote follows months of wrangling over the policy, which was previously approved by the government as an emergency regulation, but then blocked by the Supreme Court pending new legislation. Notably, Shin Bet chief Nadav Argaman opposes the using his agency to go after the virus, while the issue has been pushed through by Prime Minister Netanyahu and Health Minister Yuli Edelstein. And for more, let's now go to the streets of Ashdod, which is south of Tel Aviv, where our correspondent Adi Koplowitz is standing by for us. Hello again there, Adi. As I just mentioned, police really ramping up their presence on the ground to try and enforce these rules laid out by the Health Ministry. Are people following them?
Well, Sarah, it depends very much on what area are we talking. What we can see here in Ashdod, that for the first time since the coronavirus erupted in Israel, is really showing a steep rise in the number of patients and the number of cases of coronavirus, is that people didn't quite get used to these regulations. And a lot of people out on the streets, here in the beach also, of course, but also out on the streets, are not wearing masks. And we're not seeing too much enforcement around it. However, if you compare this to areas like Jerusalem or Tel Aviv, which were more harshly infected at the beginning, you see that people are following instructions a lot better. Now the police is starting the campaign to enforce this regulation. The fine for not wearing a mask was doubled from 200 shekels to over 400 shekels now. So really, there are some efforts to enforce this harder and to help the public behave accordingly and try to prevent an eruption. Right now, we are seeing different warnings from both the Ministry of Health and intelligence experts in the Israeli military. All are talking about a new wave of the coronavirus, and that if strong measures won't be taken quite soon, then Israel is definitely expecting to see another wave of coronavirus. This may be the reason that Prime Minister Netanyahu is pressing so hard on allowing the government and the parliament to use this ability of the Shin Bet to track down corona patients, also in retrospective, in order to understand where exactly they have been. This could really help to locate places that could infect people with coronavirus and maybe prevent more people from getting infected. The other option, if this method isn't approved by the parliament eventually, is to just use a mass lockdown as was used before, and this could definitely damage the economy a lot harder than the first lockdown already did. A lot of civilians are expected to reject that completely, and this is probably why the government is trying so hard to get the approval and maybe use this tracking down to get more accurate lockdowns instead of a mass one that would damage so many people and so many businesses.
So, Adi, tell me, if we do indeed see another lockdown, if these cases continue to spike, would it be similar to the one we saw last time?
Well, it's hard to believe that unless there is a very significant wave of corona patients, the government will try to implement a similar lockdown to the one that we have seen before. People haven't recovered quite completely from the damages of the first lockdown. And right now it doesn't seem, and the general feeling among the public in Israel is that the government isn't compensating the people who lost a lot of their income during this time. So it's hard to believe that the public will cooperate with such a lockdown. On the other hand, if this time the government guarantees some assistance and some economic assistance to the people and maybe say what is the horizon, what are the plans, and for how long this lockdown should last, this could encourage people to support and cooperate with another lockdown. However, what we're seeing right now is that Prime Minister Netanyahu is trying to get that ability of the Shabak, the security agency of Israel, to track down patients and not close down the whole country one more time, out of an understanding that really another lockdown will damage the economy very roughly, and Israel will have a very tough time trying to recover from this.
And Adi, fairly briefly, I'm just looking at you on the beach there. It looks beautiful, but some potential further closures I've just seen published in Israeli media. We are hearing that a number of beaches in Bat Yam, which is just south of where we are now, may be closed for around a week.
That's right. Some of the beaches in Israel are already being closed in cities where there are a lot of patients and there's a wave of coronavirus infections. Ashdod right now is not on the list. However, the Ministry of Health did request and did recommend that some specific neighborhoods here in Ashdod would be defined as red zones and would be closed down. It hasn't reached the beach yet, but now that what we're seeing in Bat Yam shows that closing down the beach in order to prevent infections is also an option, and that may happen here in Ashdod too at some point.
All right, Adi Kopelwitz, thanks for the update. We'll come back to you a little later. Now, a new vaccine developed at Oxford University has not yet been proven effective on humans, but optimistic researchers in the UK have already started producing vaccine kits and are preparing for extensive production. Amit Harari has the story.
A grim warning from the World Health Organization.
We expect to reach a total of 10 million cases within the next week. This is a sober reminder that even as we continue research into vaccines and therapeutics, we have an urgent responsibility to do everything we can with the tools we have now to suppress transmission and save lives.
That's in addition to fears the virus has yet to peak in the Americas. Meanwhile, a real breakthrough might come from the United Kingdom, where clinical trials of the coronavirus vaccine will begin Thursday on humans.
So far, we've got thousands of people vaccinated in the UK in our vaccine trials. We started in April, and we've been gradually increasing the numbers that we vaccinate as we move through the phase 1, the phase 2 and the phase 3 trials. We're up to about 7,000 people vaccinated now, so that's really great progress. And this week, another important milestone, trials started in Brazil and today in South Africa, so we're extending the range of the clinical trials that we're doing now.
Scientists from the University of Oxford, where the vaccine was developed, say the odds of it being successful are about 80%. Over 70 vaccines are currently under development around the world, but so far only 2 countries have conducted human trials, the US and China. The new vaccine was developed out of a harmless virus that was taken from chimpanzees and re-engineered to contain part of the coronavirus. This technique has been tried in the past and has provided encouraging results in the context of other diseases. Despite some people's skeptical opinion, the British government has made a significant move and has closed deals with several factories inside and outside of the country, so they can start producing the vaccine soon.
Meanwhile, deaths from coronavirus continue to rise in Iran, 134 fatalities in the last 24 hours, bringing the total death toll to more than 10,000 people. Now, it's the highest number of corona-related deaths since April 6, as the Islamic Republic continues to contain the virus. Authorities are continuing to deny Iran is in the midst of a second wave, with the health ministry making pleas to the public.
We call on all our compatriots to follow the health protocols, especially the elderly and those with underlying diseases. We also urge children and young people not to be present in crowded centres, to keep their distance from elderly, grandparents, and to help them stay at home as much as possible.
Short break, but when we come back, Hamas is threatening Israel with war if it goes through with its annexation plans. All of that and plenty more. Stay with us.